Okay, so good morning, everybody. So as promised, I have got a number of workshop tutorials and this one or this set of tutorials are all around diabetes, and I'm so delighted to have with me today Karen Lewis, who I'll let you introduce yourself. That's probably the best thing to do. So.
Okay. Well, hello everybody. My name's Karen Lewis. So I qualified as a registered nurse in 1984. And for the last 5 years of my career, I specialised in diabetes. So I was a diabetes specialist nurse. And then I retired about 3 years ago, which you could do if you joined back in the day. You could go when you were 55. So I retired 3 years ago. And I started working on the diabetes prevention programme. So for a number of years, I've been very interested in health and well-being. And now I work on diabetes prevention.
Wow. And that's, I assume, is a big growing area.
Yes, so within the last couple of years, the NHS has developed a programme to help people who are what's known as pre-diabetic to get their blood sugars back down to normal. And it's a win-win for everybody, because I'm sure people listening are aware the big chunk of the NHS budget goes on diabetes and complications of diabetes. So obviously the NHS do not want people to develop diabetes, and individuals themselves don't want to develop diabetes. So it's a 9-month course that the NHS have put together to help people get their blood sugars back down to normal. So to basically prevent diabetes.
Okay. So how would somebody know that they are pre-diabetic or diabetic? Is it something that manifests itself in these niggly little things that people kind of suffer from, that they go to their doctor with, and then there is a diagnosis?
Yeah, I mean, type 2, it's important to talk about type 2 actually, because it's 90% of the cases of diabetes are type 2, and it's the epidemic of diabetes we talk about in this country. So as we said, sometimes we can be completely asymptomatic without symptoms. And that's why it's so important to attend your well woman or well man appointment and get the blood test for diabetes. The sort of symptoms people can get if you've got raised blood sugar, which is pre-diabetes and diabetes, is if you're actually passing a lot of urine. And that's because the body's trying to get rid of this sugar. So one of the ways it does that is to you pass a lot of urine. People typically with type 2 diabetes are middle-aged or older. So it's difficult to spot that one. Because if you're like me, I'm 58, I've had 3 children. And if I'm passing a lot of urine, I'd probably think, well, my bladder's a bit shot from childbirth, you know. And men often think, oh, my prostate, maybe I'm getting prostate problems. So people don't always assume it's connected. But if you're passing a lot of urine, certainly that can be a sign of diabetes. Thirst can be another sign, because again, as I say, the body doesn't like the blood sugar being up, and it makes you dehydrated. And it wants you to drink lots of fluid to get this sugar out of the blood. So thirst, passing a lot of urine are signs and symptoms of pre-diabetes and diabetes.
Okay.
The other thing is tiredness, because obviously the sugar in the blood, the idea with that is to put energy in the cells. And if that isn't going very well, people can feel tired. So that's another one. If again, 58, if I was tired, I'd just think, well, I'm getting older. So it's one that people don't necessarily pick up on.
Yeah.
Sometimes you can get some blurred vision. And the reason behind that is you can get sort of sugar building up in the fluid levels in the actual eye. And again, aging. So some of these signs and symptoms can be there, but we don't always assume that they're related to raised blood sugar. We also get prone to infections, and we might all have heard about COVID, people with blood sugar being more prone. It can impact on your immune system as well, but certainly things like thrush, so candida, that's oral or genital thrush, because obviously the sugar, this glucose, is a really good medium for infections to grow. So it's things like being thirsty, it's peeing a lot, it's feeling tired, perhaps some blurred vision, being more prone to infections. These are typical things, you know, with diabetes.
I think one would assume that somebody who was overweight and eating a lot of sugary foods would become diabetic, and therefore maybe is not surprising. Do you get any sort of particularly thin diabetic?
Yes, absolutely. So genetics can play a part. Even if you've got a strong history of diabetes in your family, that doesn't mean to say that with lifestyle changes you can't get your blood sugar back down to normal. So yes, we do get referrals from people who are slim, and they just obviously the quality of their insulin may be affected by sedentary lifestyle, or they just don't tolerate carbohydrates as well as other people. So not everybody is overweight. And of course, there are different BMI guidance for people from Black and Asian community where they have to have a lower BMI because they're more at risk. So, yeah.
So all in all, I think it's clear to say that we should all be aware that diabetes is a thing. It's a lifestyle thing,
Yeah.
and we should find a way to be proactive rather than reactive. So
Yeah. Yeah. Yeah.
and Karen, we're going to go on and we're going to look at three other areas. So next we're going to look at what should somebody expect from you. You mentioned a well woman or a well man.
Yes. Yes. Yes.
We're going to start to look at that, and also what a diabetes test would be about and how people can self-refer.
Yeah.
And we're also then going to really sort of knuckle down on the body and the anatomy and physiology.
Okay. Yeah.
How what is diabetes and how it actually manifests it's in our body, and what else can go wrong, because I think that's some people need to be scared of something that's going to go wrong to become proactive rather than reactive.
Yeah. Yeah.
And,
Yeah.
and then in the last section that we're going to put out, we're going to look at what can you do proactive rather than reactive, and where the support is out there. So thank you so much.
Very welcome.
And look forward to catching up with you in a little while.
Okay. Thank you. Speak soon.